Hi, thank you for taking the time to listen to me to talk about the Tai Chi program for Parkinson's. My name is Grandmaster Franklin, and I've been doing Tai Chi for well over 50 years and teaching it as well. I started the Tai Chi for Parkinson's about 30 years ago, and I have developed a certain type of a program which will work with a person that has Parkinson's through all the different stages. I have contracted and worked with such organizations as the Muhammad Ali Parkinson's Association, the Barrow-Neurological Institute, and the PWR Gym in Tucson. Now here would be some of the program, the exercises, a sample of the exercises which I will demonstrate that would be part of my Tai Chi chair program. Now I'll give you some of the fundamentals of the Tai Chi from the sitting position. We're going to start from the most difficult things and then we'll work towards the things which are much, much easier. Now this would be done by a person who is in the second stages or the middle stages of Parkinson's, where they're having more problem sitting, more problem standing and moving, so they have to be from a sitting position. So the sitting Tai Chi, you want to make sure that you're in a nice flat chair, sitting all the way back. You could use arms or you could do it without arms. Feet are firmly planted on the floor. The first thing to do, as in any exercises, what you need to do is do some warm-up exercises prior to starting. And at the ending part of the exercise, we also do some cooling down type of exercises too. Now keep in mind that these practices are supposed to be done at least once a day for about 10 to 15 minutes each time. And you could follow along with me through my internet interactive Tai Chi program, or you could attend one of my classes or lectures. Anyway, now we'll get started. I'm going to slip a little bit further towards the chair, raising both arms on the knees, rotating the shoulders backwards a couple of times to loosen up the shoulder muscle, and then rotating them forward. Then dropping the head from side to side, loosening up the neck, and then back and forth, loosening up the neck also. And then in a rotation going one way and in a rotation going the other way, also to loosen the neck. You let the hands dangle at the side, just kind of shake them out, allowing the blood circulation to go to the fingertips first. You shake them out, you shake vigorously, and then you do a couple of flashes with the hand to make sure that the blood goes all the way down to the fingertips. And then you're going to raise the hand above the head as much as you can and do a long stretch, and this time you're going to make a yawn. Then lower the hand. And we're going to start with a series of pushing exercises. The pushing exercise is going to require you breathing from the diaphragm and out through the mouth. You inhale through the nose and exhale through the mouth through a tiny straw. Movement that comes in towards your inhale goes away from your exhale. So you start by placing the hands in the center, turn the hands forward towards your body, and as you push out, you exhale. Then drop the wrist, coming back, inhale. And exhale, pushing out. Inhale, pulling back. Exhale, pushing out. Inhale, pushing back. Then pushing the hands down, exhale. Now to loosen the spine, the hands will dangle like this. Bring the hands forward. Bring the hands out to the side, like this. Raise them up about heart level. 2 fingers are pointing upwards. You come in. This would be an inhale. This is an exhale. This is an inhale. This is an exhale. Inhale. Exhale. Inhale and push down. You tilt the body forward, stretch the back out, place the hands on the knees to make sure that you're in a firm, strong position and you're not going to fall over. Push down and then push back up. I'm going to repeat that twice. Push down and push back up. And then push all the way back and just let everything relax. So now you're in a position that you're getting ready to start the first movement. The first movement is very simple. You place the foot parallel to each other, toes are pointing straight out, hands are at the side. Again, keep in mind that movement comes in towards you, inhale, goes away from exhale. You raise up, this would be inhale, and then the left hand falls, and you circle the left hand like you're cupping, holding the ball diagonally. Take the right foot, slide the right foot a little bit to the side, and then slightly tip the body, turning. Then push down with the right hand and let the left hand rise. And turn both hands over, hold the ball again. Heel back a little bit, shift the foot over a little bit more, and pushing towards the right. Exhale, as the right hand goes up, left hand. When you catch a ball, let the hands fall. And then come back towards the center, place the left palm on the right wrist and push forward. And heel back and push again. And this movement is called a single whip from a chair position. You pivot on the toes like this, scooping in with the hand, holding this position, sliding the left foot out, letting the left hand parallel with the left foot. And then from that position, we're just going to rest. Now that's a good example of what the exercises are going to be. We also, like I said, we also going to emphasize the breathing as much as we can to make sure that you get the fullest amount of impact or benefit from this particular exercises. Now, my program runs every Friday, and it's an interactive program that I could see you, you could see me, and we could talk while we're doing the exercise. In other words, I could correct you, but you will be in the comfort of some place like your home, and you should make sure you wear loose clothes, something very comfortable, and that you're in a comfortable setting, such as the temperature should be in a pleasant condition that you're very comfortable there. And at that point, we could start the exercise. So you basically have to email me, let me know your intentions, and then I will send you a code to get into the program that you could actually participate with the class live. And this class, of course, will be syndicated. And if a person wants to have a videotape of the class, they could also have that with an additional cost. So thank you very much for listening to me, and happy Tai Chi to you.